Senator from Florida.
Thank you, Mr. President. I want to follow up with the comments of my colleagues from Nebraska and Arizona. I won't be as eloquent, I think, as them, but I want to also lend my voice to this discussion concerning health care. Mr. President, I had the opportunity to receive the House bill, 1,990 pages. It's not an easy read. I'm making my way through it, Mr. President, but we have learned a lot through it. I've already found that the taxes start on about page 297, and there's an estimated over $1 trillion in costs over the next 10 years in these 1,990 pages. Now, this is the House bill, the bill that Speaker Pelosi has put forward. We don't yet have a copy of the Senate bill to digest, so this is the text that will go on for now. But I think, Mr. President, it's good to see the larger context in which we debate health care. It's important to remember that this year, this Congress has passed a budget that has a record-setting $1.4 trillion deficit. That's more deficit than the last 4 years of Congress combined. Americans want and deserve more affordable health care. We have more than 40 million Americans without health insurance, nearly 4 million of them in Florida. They want better access to health care, and they certainly want their health care to be less expensive. But putting this in mind, we have to look at the situation that we find ourselves in, that the reckless spending of this Congress must stop, or we are going to bankrupt the future of our children and of our grandchildren. The senator from Nebraska was talking about letters that he received from his constituents. I sit in my office this morning and looked at some of the letters that come in from folks in Florida, and I wanted to read, Mr. President, for the record, one from John Miller from Valrico, Florida, which is in the Tampa Bay area, right near Brandon. He writes it, it's in handwriting, it's not typed out, it's from October 19th. He says, Mr. LeMieux, I'm one of those who've not paid enough attention to what is going on. Well, like others, I'm waking up. I have decided to go old school and start handwriting letters again. It was recently reported the federal deficit for 2009 fiscal year was $1.4 trillion, up from $459 billion the year before. I think it is time for Congress to stop all work and start working on ways to cut the deficit. One way is to shrink the government. So I think Mr. Miller in Valrico, Florida gets it, Mr. President. Before we start embarking upon 1,990-page endeavors to create new entitlement programs that cost $1 trillion, we should focus, as Senator Johans from Nebraska said, on the programs that we already have. And we should do so through the lens of the debt and deficit that we have now that is going to bankrupt the future of our children. Right now, we spend $253 billion a year in interest alone. $253 billion to pay the interest on our debt. That's the third highest expenditure, Mr. President, that we have in the federal budget, $700 million a day. The national debt is nearing $12 trillion. In the next few days, we will reach that mark. White House projects we'll be at $23 trillion in 10 years. The national debt grows at a rate of $4 billion a day. It took us until 1982 to hit $1 trillion in debt. Now we're near 12. When I gave my maiden speech, Mr. President, a couple weeks ago, I tried to put some real-world context into what these amounts of money mean. Because $1 trillion or $1 billion, they're numbers that are hard to understand. I said in that speech that $1 billion laid edge to edge in $1 bills would cover the city of Key West, Florida, about 3.4 square miles. $1 trillion would cover Rhode Island twice. Another way to think of it is if you had $1 bills and you stacked up $1 trillion, it would be 678 miles high. These are staggering amounts of money. So where will all this spending lead us? Well, I think we know. When you have too much spending, you have to increase taxes. And when you increase taxes, you reduce prosperity. We know that this 1,990-page bill already increases taxes. Mr. President, Peggy Noonan in the Wall Street Journal this weekend talked about the problems of New York, and I don't mean to single out my friends from New York, but I thought that what she said in her article was telling, because here's a state with high taxes. She said that the Post reported this week that 1.5 million people have left high-tax New York State between 2000 and 2008. more than 1 million of them from ever higher taxed New York City. They took their tax dollars with them, more than $4 billion in 2006 alone. Now, I don't know that people are going to leave the United States of America because we have taxes that are too high, but as I said in my maiden speech 2 weeks ago, Mr. President, I'm very concerned that one of my 3 sons, Max Taylor Chase, or maybe the baby that we have on the way, is going to come to me when they're an adult and say, Dad, my opportunities are better in another country because I don't want to pay 60% taxes to pay for the deficit and the debt that you've laid on my shoulders. I hope that day never comes. So what should we do? Instead of focusing on new entitlement programs, perhaps we should try to fix the ones we already have. Medicare, health care for seniors, and Medicaid, health care for the poor, have huge amounts of waste, fraud, and abuse. An estimated $60 billion in waste, fraud, and abuse in Medicare alone. $60 billion. There could be as much as $225 billion in fraud and abuse and waste across the whole health care system. So, Mr. President, I seek to be a problem solver in this chamber, and I seek to bring Democrats and Republicans together. So last week I introduced my first bill, Senate Bill 2128, the Prevent Health Care Fraud Act of 2009. And what that bill does is simply 3 things. Number 1, it creates in the Department of Health and Human Services a deputy secretary, number 2 person in the agency, that will be the Chief Healthcare Fraud Prevention Officer of the United States. And they will be responsible for nothing but one job, to make sure that we ferret out healthcare fraud. Number 2, we will bring predictive modeling to healthcare administration in this government. What is predictive modeling? Well, an easy way to understand it, it's the same way that your credit cards work. If you go to make a credit card purchase and your credit card company thinks it's a questionable transaction, the computer has a model and you get a phone call or an email, and if you don't call in and validate that transaction, the vendor doesn't get paid. Happened to me just a week or 2 ago. I went to go buy a television here in Washington, D.C. I'm from Florida. I get an email on my BlackBerry before I walk out the door saying, did you authorize this purchase? We don't do that in healthcare. Instead, we chase the bad guys later and try to get the money back. This would stop the money from ever being paid. The third thing it would do is we're going to require background checks for healthcare providers. The American people would be surprised to learn that we don't do this right now, and that we have people ripping off Medicare and Medicaid in this country, $10, $20 million a shot. In fact, my state, in Florida, specifically in Southeast Florida, we are the healthcare fraud capital of the world. We need to do a better job of spending the money of the people now before we embark upon new programs to spend trillions more. Senator Kyle from Arizona a moment ago mentioned the Wall Street Journal's editorial today. It called this bill the worst bill ever. That's a heck of a name. Why? They said because it implements a spending surge to the tune of more than $1 trillion. It has $572 billion in new taxes, and it threatens to bankrupt the state. Senator Johans just mentioned this. He's a former governor. I was the chief of staff to a governor. I know how difficult it is to make ends meet in a state system where you actually have to balance budgets. Not like the federal government where you can just, spend more money and print more money. The states actually have to balance budgets. And in Florida, we spend more than 30% on health care. And if you spend more money on health care, specifically Medicaid, guess what you spend less money on? Education and other good programs. So with these increased Medicaid obligations, the states are going to be in more of a difficult place. They're going to have to either cut other programs or they're going to have to raise taxes. The Wall Street Journal said that we can't regulate our way out of the reality that we live in a world of finite resources and infinite wants. Mr. President, we should focus on the programs that we have before we embark upon new programs. The majority in this chamber want to focus on new programs and not on effectively and efficiently running the programs that we have. I hope that my colleagues from both sides of the aisle will join me in supporting Senate Bill 2128, the Prevent Healthcare Fraud Act of 2009. And with that, Mr. President, I yield the floor.
Mr. President,
Senator from California.